Benefits of keto diet for diabetes. Is the keto diet and diabetes compatible? The ketogenic diet, often called the keto diet, has gained significant attention for its potential role in managing diabetes. Research suggests that the keto diet may help improve blood sugar control in individuals with diabetes by reducing carbohydrate intake and promoting the body's reliance on fat as its main source of fuel. Because carbohydrates have the most immediate impact on blood glucose levels, restricting them can lead to more stable blood sugar throughout the day. For people with prediabetes, this dietary approach may even support reversing early signs of the condition. The core of the keto diet is consuming foods that are high in healthy fats, moderate in protein, and very low in carbohydrates. By doing so, the body enters a state known as ketosis, where fat rather than glucose becomes the primary energy source. This shift may offer several benefits for people with type 2 diabetes, including better insulin sensitivity and weight management. However, it is essential to note that the keto diet is not without risks. Potential side effects can include nutrient deficiencies, increased cholesterol in some individuals, and difficulty sustaining the diet long-term. For this reason, it is strongly recommended that anyone with diabetes consult their healthcare provider before beginning a keto diet. In summary, while there are clear potential benefits of the keto diet for diabetes, including improved blood sugar control and possible reversal of prediabetes, this dietary approach should be carefully evaluated with medical guidance to ensure safety and effectiveness for each individual. Benefits of a keto diet for people with diabetes. Research has shown that the ketogenic diet can provide meaningful benefits for individuals living with diabetes. By significantly reducing carbohydrate intake and encouraging the body to burn fat as its primary source of fuel, the keto diet may help improve several important health markers. Some of the most recognized benefits of the keto diet for diabetes include reduced body weight. Weight management plays a key role in diabetes control, and many individuals experience weight loss on a well-planned keto diet. Improved fasting blood sugar levels. Lowering carbohydrate intake can help stabilize blood glucose, reducing spikes and dips throughout the day. Improved fasting insulin levels. The diet may improve insulin sensitivity, which supports more efficient blood sugar regulation. Reduced need for medication. In some cases, individuals are able to decrease or even eliminate their diabetes medications under medical supervision. While the potential benefits are promising, it is important to approach the keto diet carefully. Individual responses can vary, and not everyone with diabetes will have the same outcomes. For this reason, professional medical guidance is essential before making dietary changes. Improved blood glucose and insulin resistance. One of the key benefits of the keto diet for diabetes is its impact on blood glucose and insulin resistance. By significantly reducing carbohydrate intake, blood glucose levels naturally decline. This makes it easier for people with diabetes to manage blood sugar on a daily basis. Healthcare providers already recommend that individuals with diabetes limit carbohydrates and avoid foods that cause rapid blood sugar spikes, such as refined sugars. Because of this, the ketogenic diet has emerged as a viable low-carbohydrate option for diabetes management. When glucose levels are lowered, insulin levels in the blood also decrease. Insulin is the hormone that allows cells to absorb glucose and use it for energy. However, in conditions like prediabetes, metabolic syndrome, and type 2 diabetes, the body can become resistant to insulin, causing blood sugar to remain elevated. By improving insulin sensitivity and reducing resistance, the keto diet may allow people with type 2 diabetes to reduce, or in some cases, eliminate, their reliance on diabetes medications, under medical supervision. Potentially improved lipid profile. Another possible benefit of the keto diet for people with diabetes is its effect on lipid levels, though research has produced mixed results. Your lipid profile includes levels of HDL cholesterol, often called good cholesterol, and LDL cholesterol, often called bad cholesterol. Higher HDL levels are linked to reduced risks of heart disease and stroke, while elevated LDL levels are associated with greater cardiovascular risk. Some studies have found that the ketogenic diet improves overall lipid profiles by raising HDL cholesterol without significantly increasing LDL cholesterol. Other studies, however, report that LDL cholesterol can rise on a keto diet, even when HDL also increases. These differences often depend on the types of fat consumed. Diets that emphasize healthy fats, such as those from fish, nuts, seeds, and olive oil, tend to produce better outcomes than diets high in saturated or processed fats. Risks of a keto diet for people with diabetes. While there are clear benefits of the keto diet for diabetes, it is equally important to understand the potential risks. The ketogenic diet is highly restrictive, allowing far fewer foods than it eliminates. This makes it difficult for many people to maintain long-term, and in some cases, it may pose serious health risks. For individuals with type 1 diabetes, certain complications can occur more frequently when following a keto diet. These may include hypoglycemia, dangerously low blood sugar, diabetic ketoacidosis, DKA, a life-threatening complication when insulin levels are too low, dyslipidemia, or abnormal blood lipid levels. Beyond type 1 diabetes, people with other health conditions, or those at different life stages such as pregnancy, also need to be cautious before attempting a ketogenic diet. Hypoglycemia. One of the most immediate risks of a keto diet is hypoglycemia. Because carbohydrate intake is sharply reduced, blood sugar can drop to dangerously low levels. If left untreated, hypoglycemia can cause seizures, loss of consciousness, or worse. Early warning signs of hypoglycemia include shakiness or feeling jittery, extreme hunger, dizziness or lightheadedness, rapid or irregular heartbeat, headaches, blurred vision or slurred speech, confusion or irritability. Recognizing these symptoms early is critical. Severe hypoglycemia always requires emergency medical treatment. Diabetic ketoacidosis, DKA. Another serious risk, particularly for individuals with type 1 diabetes, is diabetic ketoacidosis. DKA develops when the body does not have enough insulin to move glucose into cells for energy. Instead, the liver begins breaking down fat, releasing acids called ketones. When ketone levels build up too high, they can become toxic, leading to life-threatening complications. Signs and symptoms of diabetic ketoacidosis include rapid, deep breathing, dry skin and mouth, flushed face, breath with a fruity odor, severe fatigue or muscle stiffness, headaches, nausea, vomiting, or stomach pain. Anyone experiencing these symptoms should seek immediate emergency care. In summary, while the keto diet may offer important benefits for people with type 2 diabetes, it is not without risks, especially for individuals with type 1 diabetes or other medical conditions. That is why professional medical supervision is essential before beginning this diet. When to avoid the keto diet if you have diabetes. Although there are clear benefits of the keto diet for diabetes, this approach is not suitable for everyone. For certain individuals, the risks may outweigh the potential advantages. People with type 1 diabetes should be especially cautious. The keto diet can increase the risk of diabetic ketoacidosis, DKA, a dangerous complication that occurs more often in individuals with type 1 diabetes. Anyone with this condition who is considering the keto diet should only do so under strict medical supervision. Dyslipidemia and heart disease risks. Another potential concern is dyslipidemia, abnormally high cholesterol levels, which can occur in some people on a ketogenic diet. Dyslipidemia increases the risk of cardiovascular disease, meaning individuals with diabetes who also have a history of heart disease should approach this diet with care. That said, research findings are mixed. Some studies suggest that the keto diet does not worsen cardiovascular risk over a 2-year period, while others highlight negative effects on cholesterol. The type of fats consumed often plays a major role in these outcomes. Other contraindications. The keto diet may not be appropriate for pregnant or breastfeeding women. Animal studies suggest that high ketone levels could negatively affect maternal and infant outcomes. Individuals at risk for non-alcoholic fatty liver disease, NAFLD. Some animal studies suggest that ketogenic diets may increase this risk, though results in humans remain unclear. How to follow the keto diet safely. The ketogenic diet is highly structured. It requires eliminating or sharply reducing carbohydrates and obtaining the majority of calories from fats. By doing this, the body shifts into a metabolic state called ketosis, where fat rather than glucose becomes the main source of energy. It is important to note that ketosis is not the same as diabetic ketoacidosis. Ketosis is a safe metabolic process when properly managed, while ketoacidosis is a medical emergency. To ensure safe ketosis, Ketone levels can be measured at home using urine test strips or through blood testing. Many healthcare providers recommend monitoring ketones regularly when beginning the keto diet, especially for people with diabetes. To achieve ketosis, you will need to eliminate most dietary carbohydrates. Focus on healthy fats such as olive oil, nuts, seeds, and fatty fish. Maintain moderate protein intake to avoid disrupting ketosis. Carbohydrate goals on the keto diet. The primary goal of the ketogenic diet is to stay below a set number of carbohydrates per day. While the exact amount can vary depending on the individual, most people need to consume fewer than 50 grams of carbohydrates daily to maintain ketosis. However, the type of fat chosen on the keto diet makes a significant difference. Saturated fats, found in foods like butter, full-fat dairy, and fatty cuts of meat, can increase LDL cholesterol and raise the risk of heart disease. By contrast, unsaturated fats, such as those from avocados, nuts, seeds, and olive oil, are linked to better heart health and are the preferred choice for long-term success. Other low-carb diet options. While the ketogenic diet is the strictest form of low-carb eating, there are other diets that can also support blood sugar management for people with diabetes. Atkins diet. Similar to keto in that it restricts carbohydrates, but it allows more flexibility, particularly with protein intake. The Atkins plan includes different phases, gradually adjusting carb intake to help people achieve weight loss or metabolic goals. Mediterranean diet, focused on whole foods, including fruits, vegetables, whole grains, fish, and healthy fats. While not always classified as low carb, it can lower carb intake compared to the standard Western diet. Studies suggest it may be easier to maintain long-term than the keto diet. All three, keto, Atkins, and Mediterranean, have been shown to help manage blood sugar levels. The right choice depends on your health status, lifestyle, and long-term sustainability. Choosing the diet that's right for you. There is no single diet that works for everyone with diabetes. While the benefits of the keto diet for diabetes include better blood sugar control and weight management, it is also highly restrictive. The Atkins and Mediterranean diets, on the other hand, may offer more food variety and flexibility. The best approach is to work with your healthcare provider to weigh the benefits and risks of each option, tailoring a plan that matches your health needs and goals. Counting carbohydrates. Carb counting is essential for anyone following a low-carb or ketogenic diet. This involves tracking your carbohydrate intake throughout the day to ensure you remain within your limit. Key points to remember. Carbs are measured in grams. One serving equals about 15 grams, but many foods, such as a single potato, contain more than one serving. Carbs include sugars, starches, and fiber. Any food in these categories counts toward your daily limit. Daily carb allowance depends on the plan. Keto typically requires fewer than 50 grams per day, while a standard low-carb diet may allow up to 130 grams. Over time, carb counting becomes easier as you learn the carbohydrate content of your regular foods. Helpful strategies include using carb counting apps, sticking to familiar foods, or working with a registered dietitian. Working with a dietitian or nutritionist. If you are new to low-carb eating or struggling to adapt, a registered dietitian or nutritionist can help. Together with your healthcare provider, they can design a meal plan that meets your nutritional needs while keeping your carb intake within target levels. Monitoring diabetes on the keto diet. Monitoring ketone levels is a critical part of safely following the keto diet with diabetes. While ketosis itself is safe, excessive ketones in the blood can lead to diabetic ketoacidosis, DKA, which is a medical emergency. Most people on a keto diet check ketone levels daily. Testing is often most accurate in the morning or after dinner. Ketone test strips, available at pharmacies, allow you to measure ketones using a urine sample. The strip changes color, which you then compare to a chart provided with the kit. In addition, your healthcare provider may recommend regular blood sugar and ketone monitoring in their office to ensure safe progress. The ketogenic diet can be a viable option for managing blood sugar in people with diabetes. Research highlights several potential benefits of the keto diet for diabetes, including improved insulin sensitivity, better blood sugar control, and weight management. However, it is not without risks. The diet is highly restrictive, and in certain cases, such as type 1 diabetes or pre-existing heart disease, it can pose serious, even life-threatening complications. Ultimately, The diet you choose to help manage diabetes should be personalized and developed in consultation with your healthcare provider. Whether you decide on Keto, Atkins, Mediterranean, or another approach, professional guidance is essential to ensure safety and effectiveness. If you found this video helpful, make sure to like, share, and subscribe to HeInfo, your trusted source for science-backed health information. Have you ever tried a low-carb diet to manage diabetes? Share your experience in the comments below. We'd love to hear your story. And don't forget to turn on notifications so you never miss our next video on evidence-based strategies for better health.